must make sure that your needs will be met even if you are unconscious, unable to breathe or talk. Here are the tools that enable you, your PA, paramedics, and other health professionals to meet your needs in an emergency. People with disabilities and chronic illnesses often find themselves in emergency situations. There are two kinds of emergency. One, life-threatening emergencies that need immediate medical attention. Two, other emergencies that need the attention of a medical professional but are not immediately life-threatening. Know your disability. Does it cause certain emergency situations to happen more often than others? If the answer is yes, be sure to include information about your specific emergencies on an emergency medical information form. You also should review this information with your personal assistants. Your PAs may or may not have training in emergency first aid or CPR. If they do not, you must provide them with some general information that will help them to assist you in an emergency. You may want to ask your PA candidates at the time of interviewing for the job if they have training in first aid or CPR. Training can be found by contacting your local American Red Cross or other agencies. Train your PA to stay calm, to use their common sense, and provide them with some simple guidelines so they can help you. Post 911, the emergency call number, prominently on or near your phone. Better yet, put it on speed dial on your phone. Keep written instructions on what information to give the 911 operator. The instructions should include the street address, the nearest cross street, and any other identifying information that will help the 911 dispatcher in directing emergency assistance to you. Check your telephone book. Usually, the front section of your telephone book contains a first aid and survival guide in the customer guide section. It covers the following topics: bleeding, breathing, broken bones, burns, some disaster survival such as earthquakes, electric shock, heart attack, poisoning, seizure, and how to use the telephone in emergencies. Review this material with your PA and keep it where it can be easily found. Post a list of your healthcare provider's phone numbers: doctor, visiting nurse, emergency room or health treatment center, and family member contact information. Calling 911. Call 911 only for emergencies. When you need help or advice but the situation isn't life-threatening, call the non-emergency numbers for the fire or police department. When calling 911, tell the operator your name, the name of the person needing assistance, the street address and cross street, nature of the emergency, the number you're calling from, the disability or pre-existing medical conditions. In a life-threatening emergency, you or your PAs should not only call 911, but also care for the person in distress. There are some emergency situations that are not life-threatening, but need immediate attention. In these situations, notify the doctor or go to an urgent care clinic or hospital emergency room. If a person has a temperature greater than 102, has diarrhea that lasts longer than 24 hours, has swelling, pain, and redness in the legs, has fainted and is difficult to awaken. If you or your PA is not sure that a situation is an emergency, call one of the following to get the clarification: the doctor or the nurse at the doctor's office, the emergency room or home health care nurse. Preparing for an emergency. Being prepared for an emergency now can make a big difference later. Make the following lists and kits: a first aid kit that includes a first aid manual, sterile bandages, tape, antibiotic cream, antiseptic wipes and solution, a thermometer, latex gloves, sharp scissors, and tweezers. Your disability may require other, more specialized supplies. It's a good idea to have extra prescription medications, aspirin, or other painkillers on hand. An emergency contact form, emergency medical information list, and printed directions to your home should also be kept handy just in case. These tools help you collect your emergency information into handouts that you can then print out. If you and your PA leave the house in an emergency, please be sure to take the emergency contacts form and emergency medical information form with you. Prepare for an emergency by keeping them together in a plastic bag so your PA can grab them quickly. Being prepared for emergencies may save your life. Being prepared also may prevent an incident that could affect your disability in a negative way. Prepare in advance for potential trips to the emergency room. If you have to go to the emergency room, be sure that you understand any instructions that are given for your care or follow-up that might be needed before you leave. Ask that the instructions be written for you and the PA. After the emergency room visit, call your primary care physician to tell him or her what occurred. Tell him what treatment you received and what follow-up care you might need.